Okay.
Yeah, that's great.
Thank you very much, Dr. Sahota, for your talk about biopsies, nail biopsies today. I just have a few questions about your talk. So the first is, what exactly is a diagnostic biopsy?
So a diagnostic biopsy allows us to take a small sample of whatever we're interested in finding out the diagnosis, and then send it for analysis so that we can be accurate. And when it comes to nails, it will quite often be when we're not sure what the cause of the condition is. So particularly, for example, if you've got a dark line on the nail and it's important to make sure that it's not a cancer, then we would do a diagnostic biopsy by removing the actual source of that dark line, sending it for analysis and then finding out.
Brilliant. That almost answers my second question. So when might someone need to have a diagnostic biopsy of their nail?
So quite often, if you see a dermatologist, it's possible to make a diagnosis by looking and asking the relevant questions. But sometimes, particularly if we're dealing with anything that could be cancerous, it's important to be accurate. So I mentioned the dark line, but also sometimes if there's a lump in the skin and it's not easy to tell whether it's a cancer or not, it may be necessary to remove a part of that lump, and then we know whether it's necessary to do more surgery or whether we can leave it because it's not harmful.
So what are the other things that it could be if it's not?
So, for example, a lot of times we see people with lumps and bumps around their nails. There's a condition called pyogenic granuloma, which is quite common. Very often it's seen even in children or in pregnant women, where you get a sort of a rapidly growing lump that bleeds. Now, when you have something that's rapidly growing and bleeding, immediately you think, oh gosh, could that be a cancer? But actually a pyogenic granuloma isn't. So by taking either the whole thing or at least a specimen, if not the whole thing, then you can be sure that you're not dealing with a cancer after all.
And then you don't have to make unnecessary excisions.
Correct, yes. So if you had a cancer, you might have to remove quite a lot of the skin or the nail, but if it's a pyogenic granuloma, you just remove the lump itself and not any more than that, and that avoids having to do unnecessary surgery.
And so if someone suspects that they might have one of these lines or a lump on their nail that they're a bit suspicious of, what would your advice be?
Yes, so I think it's important not to ignore things, but equally there's no need to panic if you've suddenly noticed a new thing. If you see a little, I don't know, a little mark on the skin and it disappears after a couple of weeks, then you know it's going to be fine. But if it persists, if it seems to be getting worse, then the first port of call is GPs. They can then make an assessment, and if they have concerns, refer you, if it's a possible skin cancer or a nail cancer, they can refer you very rapidly within 2 weeks to the local dermatology department. If it seems something that's not really worrisome, but they still want an opinion, then they would refer you to the dermatologist through the normal route.
Brilliant. Thank you very much.
Thank you.